Hi guys, hello everyone. Today topic is 5 moments of hand hygiene. 5 moments of hand hygiene is important for patient safety, save lives, clean our hands. 5 moments of importance of hand hygiene. Before touching a patient, before touching clean or before doing any aseptic procedures, after body fluid exposure risk, after touching a patient, after touching patient surroundings. And know the 5 moments of hand hygiene. 5 moments of hand hygiene approach was designed by the World Health Organization to minimize the risk of transmission of microorganisms between a healthcare workers to the patient and the environment. First moment is the before touching a patient. I will explain in the before touching the patient moment 1. To protect against microorganisms from the hands of the healthcare workers. Before touching the patient, like shaking hands, assisting a patient to move, touching any medical device connected to the patient. Example, IV line, urinary catheter. Before any personal care activities, that physical contact in the bathing, dressing, brushing, air combing. Taking a pulse, BP, oxygen saturation, temperature, chest auscultation, abdominal palpitation, applying ECG electrodes. Applying an oxygen mask or nasal cannula, fitting slings, braces, application of incontinence aids, including condom drainage. Conducting an oral examination without using a sharp instruments such as using mirror or probe. Performing oral X-ray. Oral nebulized medications and feeding a patient in the nasogastric tube. Next one is the movement second. Second movement is the before doing any aseptic procedures. Immediately before a procedure should be a touch prior to the patient starting. Before inserting a needle into a patient's skin or into an invasive medical device, connect to the patient. In that, venipuncture blood glucose level, arteria blood gas, subcutaneous or intramuscular injections, intravenous line flush. Before administration of any medications like intravenous medications, nasogastric tube, dressing trolley setup for an aseptic procedures. Eye drop installation, suppository insertion, vaginal fissure. Before the insertion of endotracheal tube, nasopharyngeal airways, suctioning for airways, wound dressings and wound drains, gynecological examinations. Movement 3. Third movement is the after procedure or body fluid exposure risk. In that details I will explain it. Direct contact with mucous membrane, circuit of an invasive medical device, any assessment or treatment patient care with non-intact skin or mucous membrane. Materials for any dental procedures. Contact with a using urinary bottle, bedpan. Contact with the sputum, either directly or indirectly touch a cup or tissue. Using specimen jars, pathology samples. Cleaning spills of body fluids from patient surroundings. Fourth one is the fourth movement of after touching a patient. After touching a patient, after touching an intravenous pump or their medical equipment connected to the patient. Movement 5 is the movement 5. After touching a patient's surroundings, it's when the patient has not been touched or is not present. Any items in the patient zone included bed rails, linen, table, bedside chart, bedside locker, call bell or TV remote control, light switches, personal belongings, chair, footstool that is attached to a patient bed. Thank you all of you.